You're welcome to Women's Corner. My name is Rose Blossom. Well, how are you doing this beautiful afternoon? Well, it's okay if you are just starting your day, but if you have been on all programs on Galaxy TV, thank you very much for tuning to Galaxy Television. Well, you know what we do here is always 100% conversation with women sharing their success story, the challenges. Let us know the goal. Let us know how to, would I say man of a life, but be able to face some challenges and be able to come out of it successful. So basically, it's more like a channel is UHF 27, start times is 110, and of course the digitized channel is 741. And at your convenience, like we always say, you run along to our YouTube page at Galaxy TV News to watch this program. Well, today is another beautiful woman sitting with us this afternoon to share a success story. I wanted to say she's looking like a banker, so maybe at the end of the day, I'm going to be cashing some checks, do you understand? But anyways, I'm going to make a proper introduction by reading her profile, then we get to see the amazing person behind the profile. Well, we have Oluwafunbi Fatore. She is the head and underwriting product and partnership of, is it a company? Of a company. Okay, great. So Oluwafunbi Fatore is a proficient health insurance professional with over 2 decades of progressive experience in underwriting, risk management, and medical service delivery and administration across the manufacturing, distribution, and health maintenance organization HMO sectors. She currently serves as head underwriting product and partnership at HCI Healthcare Limited, where she provides strategic leadership in managing health risks, pricing, and portfolio performance in line with organization objectives. Over the years, she has demonstrated strong expertise in health risk management assessment, underwriting, governance, and data-driven decision making. She is skilled in translating complex risks and utilization of data into practical insights that support management decisions, enhance profitability, and ensure regulatory compliance. Her work reflects a strong balance between financial discipline, customer-centric product design, and operational efficiency. Her professional journey, includes key leadership footprint at GNI Healthcare Limited, Royal Exchange Healthcare Limited, and also Clearline International Limited. Across this organization, she established and successfully managed the underwriting and medical service department, reduced claims liability, improved loss ratios, and supported premium growth, and contributed significantly to revenue generation through product innovation and account acquisition. Well, Fatore holds a Bachelor of Science degree in insurance from the University of Lagos, a postgraduate diploma in business administration, and advanced training in design thinking, leadership, and management in health from the prestigious Lagos Business School and University of Washington. She is a fellow of the Institute of Healthcare Finance and Management and a member of the Chartered Institute of Project Management. She's recognized for her leadership, having received the Best Team Lead Award twice, and is represented for her professionalism, integrity, and commitment to excellence. Well, let's give it up for Oluwafunbi. It's good to have you.
Thank you for having me.
Oh wow, so long a profile, but very apt, very detailed, and I already have a million questions in my head already, but first let me start. In as much as you do your BSc at University, University of Lagos. So what prompted you to go in for that particular course? Because it was after that course you started redirecting yourself, towards the healthcare and the management project. Yes. So tell us the story.
All right. So well, it's a very, very funny one. Insurance is not was not this popular then while we were in school. So my thought process was to study accounting. Now, when we got to, of course, after JAMB and all the university admission processing, we got some career counseling while on campus then, because I was moving in and out of campus, and I now got to understand that there was this course called insurance and actuarial science, and that got me interested in something different from the norm, because I like venturing into things that are not the norm, just to stand out. And I'm a very curious person, so that got me interested in wanting to venture into that space that is not so commonly is not a common terrain. So that was actually what got my attention, and I changed my course from accounting to insurance, and that was how the journey started.
Oh wow, that's interesting. So I like the fact that your curiosity led you to learn all of this, the insurance, then go to project management, then the healthcare also. So the journey into healthcare started from where? What happened that you're like, okay, I don't want to just do insurance, let me also do it into the healthcare sector?
All right, so I come from a home where there are a lot of doctors, a lot of nurses. So, and of course, because I wasn't a science student, but I've had that medical background growing up. Now, insurance happens to be a very broad industry, and we have, just like I said, you have the life, you have the property, and you have the health. In insurance in Nigeria, we had a whole lot of experience in life, a whole lot of experience in property, but very, very minimal in health sector. So when I graduated from school and started working, I felt, oh, why not move into the health space, because you're not bringing in health and management together, which is what I studied in school, and it was it's been a fantastic journey since then. So that was actually what birthed moving into the health insurance space.
Okay, have you ever thought we're going to have yours, like your own
HMO?
Yeah, so you could always when it is you have your own HMO, it's like you're the boss yourself, even though you're still the boss yourself right now actually, but have you ever thought about that?
Well, maybe once or twice, yes, but really running a HMO is quite a lot. It's a handful. It takes a whole lot of commitment. There are a whole lot of things that need to be put in place, and I would say I've had that thought, and maybe not in the immediate, right, but it's in the pipeline. It's a possibility. And of course, aside from owning an HMO, there's so many other things you could actually do within the industry. You could be a consultant, which seems to be another very popular line of business within the HMO space and all that. So yeah, it's something I've thought about.
Okay, so there's something I saw here. I know about copywriting, I know about rewriting, I know about writing.
Okay.
Now the word underwriting seems to be a bit new, so I would want to know what exactly is the underwriting, which of course you're not a professional all about. So explain so that we would all know what that is.
All right, so when you talk about underwriting, it has to do with taking a look at something, having a understanding of what this thing is all about, and determining, okay, how am I willing to accept this particular thing or not. So bringing it into the insurance space, the health insurance space now, we deal with health of individuals, management of health. So you want to determine if you are willing to accept a particular risk. Insurance has to do with transfer of risk from the insured to the insurer. So you want to determine, am I ready to assume this risk? Is this something I have the capacity to handle and manage properly, so that I can deliver on my promise to because it's very key. That's one of the principles of insurance. You need to be able to deliver on your promise. So you determine, will I be willing to accept this? And if I'm ready to accept this, at what terms and conditions will I accept this particular risk into my portfolio? So that's basically what underwriting is all about.
Okay, I think we can deal with that. All right. Well, you said, okay, I'm seeing manufacturing, distribution, and health maintenance. That's what you do when it comes to HMO. So,
yes.
and you work with, looking at it, like you work with 3 companies right now, right?
No, so I work with HCI Healthcare,
Okay.
right, which is one of the most prestigious national HMO in Nigeria right now. So that's basically where I work. I've worked in other organizations, so those were
the other
ones that I have worked with before this particular role. Yes.
Oh, great, amazing. So how is the work schedule like? How's the work for you? Looking at the fact that you've worked with other particular companies, and now you're working with this particular one, and it's national, it's not just, maybe a private owned or whatever. What would you say is actually the difference between this one and the former one?
Okay, well, so I would say the difference here, there is a whole lot of commitment here in terms of activities, a whole lot of things to manage and handle. The structure is there, it's more structured, and you're able to think outside the box. It's quite challenging because every day comes up with new challenges, new things you need to think about, new hurdles you need to cross, and all that, and a whole lot. So it's very enjoyable, if I put it that way.
I was expecting to say that because you said you're curious.
Very, very enjoyable because every day something new comes in. You have something to think about. You have this project to work on. You have this business deal to work deal with, and a whole lot of things. And of course, like my profile says, I'm into partnership acquisition, so I deal with a whole lot of organizations, just to make sure that we deliver value to our customers. So it's very, very interesting. Very, very interesting.
Oh, great. So right now, do you have a particular company that you run yourself, or you basically just work with the national?
Oh, okay. So I don't have a company I'm working with personally. Yeah, but I work mainly with HCI Healthcare, although I also do consultancy.
Okay.
I also do consultancy within the HMO space and in the educational sector as well. I'm very versatile.
Oh, nice.
So there are a whole lot of things I do. So I try as much as possible to articulate my time properly, so one does not affect the other. Yes, so that's how it works.
Well, so that brings me to, I like the fact that you said you like the education part. So maybe there's going to be a little bit of education here, because now the question I'm going to ask is about health insurance. Now, a lot of people do not even believe in insurance. Talk more of health insurance, because at least some people don't even believe in their health. They believe whatever they eat, they'll be okay, they'll be fine, they can take herbs or take drugs, and whatever, everything is okay. So that's even different. But I think that most people even insure their properties more than even insure their health, which is quite different. Now, it takes a company that is good enough to have an HMO for their staffs, which is very, very important. So as someone who has been in this sector for quite a while, what do you think is the major problem that a lot of people, or a myth that people believe about insurance and also health insurance, that needs to be raised? So at this time, you're raising the myth and you're giving us the fact, please. All
right. So one popular myth is insurance does not pay. When anything happens, that insurance have very sweet mouth, and when issues happen, we're always looking for excuses not to settle bills and all that.
Okay, sorry, apologies for that. We have to go on a short break. Let's quickly go for a commercial break. Then when we'll come back, we'll continue definitely with the myth, and yes, we'll be right back. Just stay with us. Right, well, I was still thinking the breaker was still on, and you were here just in, but it's okay. So let's go over to the myth that we have, and right after the myth, the fact. Yes.
So the second one is the fact that, I'm covered with the blood of Jesus. I don't fall sick, and if anything, there's no need. I don't need health insurance and all that. So they fear that, once I get a cover, something would just happen and my health will just start failing and all that. So I'm covered with the blood of Jesus, I don't fall sick, right? And those are things that we try to address. And that brings me to sensitization. And so what we do at HCI is, as much as possible, we do a whole lot of sensitization. We have forums where we go out there to talk to people about the importance of health insurance and why they need to have a health cover. You know, you could have trillions in your account, and in the twinkle of an eye, within 24 hours, if any medical condition comes up, it will wipe it all away. No one prays for that, but that's the reality of what we have currently. We see a whole lot of people coming up with cancerous cases, renal kidney failures and all that, and those are costs very, very pricey in terms of treatments and all that. So once you have a health insurance cover, it takes care of all that. The hassles are taken care of. Once you have a health cover, you have the peace of mind that, look, if anything happens at the end of the day, I am well taken care of, and I can take care of, face my business, so I can improve my profitability. And for the peace of mind, you know, the peace of mind that health insurance gives you, you cannot quantify, of course. And then access to screenings, you know, preventive. We do a whole lot of awareness in terms of preventive care. You don't really need to fall sick before you go to the hospital. It's very important for us to regularly, once a year, twice a year, go to the hospital, go and check yourself, run your vitals. A lot of us don't know our numbers. You get to see a whole lot of things online today. Someone was just walking on the road and slumped, and then we blame it on spirituality. A whole lot of them are not spiritually inclined. These are things that we have had, would have had numbers, would have had episodes prompting over, because we're not aware. We, you know, miss out on a whole lot of those things. So those are part of the benefits health insurance offers you. And the old mindset that, oh, I have to go to the hospital, I have to queue for a very long time before I'm attended to, is no longer there. You can speak with a doctor from anywhere you are. We're in the studio now. If anything happens, you could pick a call, pick your phone and speak with a doctor. You could do that at home. You could do that midnight, you know, and you get access to the same doctors you get to the hospital to see physically, get to speak with them, and everything is sorted out. Your medications are, you know, delivered to you wherever you are. If you need to run tests, you know, those the diagnostic centers could come over to where you are. If there are samples that need to be taken, get your samples. So the ease of doing things has been streamlined, you know, in this digital age, to make health insurance very, very encouraging and value bound for everyone to have access to. And that is the gospel that HCI is preaching as much as possible, from individuals to corporate organizations, to the market men and women, to entrepreneurs, to teenagers, elderly, and all that. So, you know, that's basically the whole thing about health insurance. It's for everyone, and it's easier. You don't really, and it's at a very, very affordable rate. You don't really need to spend so much, because you eventually spend a whole lot out of pocket when things happen. And a lot of times when events happen, when things happen, you might not, it might be at that point in time you don't have cash with you, right? And these things have a way of happening that when you don't have cash, it just when it comes up, and then you have to start running, calling families and friends that also have issues that they are looking
facing.
At. Exactly. But, and of course you keep your prestige. You're able to maintain your prestige because you're well taken care of. You're well put together. Your family is taken care of. You are taken care of. Even as a business owner, you take care of your staff, you know, and everyone is happy. You're productive. Things are going as expected, and life expectancy goes longer. You're not bothered with hypertensive cases and all that. So those are there are a whole lot of things you can talk about concerning health insurance. We could start from now till the next 24 hours, 48 hours, and we'll just be scratching the surface, you know. So I would say it's a beautiful thing that as many Nigerians as possible should tap into, and for those who have have enjoyed health insurance will tell you that it's second to none. It's really
I could remember then, a long time ago, you know, you hear people get insuring their cars, they get this other thing insured, basically property. So the first person I heard was not just even about the health insurance, that she had to insure her legs was Rihanna. And then people were like, hey, what is this? People are insuring cars, we understand. People are insuring house, we understand. Insuring health, we understand. Businesses, we understand. Which one is insuring leg again? So I understand what that means, but some persons do not understand. So if you could just, you know, just a little bit of breakdown, so people understand why they insure their eyes, they insure their hair, they insure their legs, not just the health now. They pick a particular body, maybe they feel that that body part is
very valuable to them. Exactly, that's the word. Very priceless. You know, in insurance, there's something we call them interest. You must have an insurable interest in whatever it is you're covering. And for Rihanna to have insured her legs, is because that leg is priceless to her. And that, we can say, that is like her tool of work. And whatever it is that you use, whatever brings money, whatever takes you places, you insure it so that nothing happens. There is no break in transmission, if I can put it that way. So you find some people tell you, oh, I want to cover my eyes, I want to cover, you know, different body parts. It's your prerogative. Now, coming to health insurance, a standard basic health insurance cover will take care of everything from head to toe, right? So you need outpatient care. Cases as simple as leg pain, neck pain, malaria, typhoid, things like that, you're taken care of. And then you move on to more advanced cases where you need to have specialist consultations. You're taken care of. All that is sorted out. Then you need to, maybe the doctor feels, okay, you can't go home today, we want to observe you for some days, so I understand how that works. You could stay back. That's you're going for on admission, you're taken care of. And you know, the beautiful part of health insurance is you get to enjoy things that ordinarily you may not be able to enjoy on an individual basis, because you're talking about pool of funds put together. So you pull funds together, I put money together, we form a pool. We're able to assess facilities that ordinarily you may not be able to have access to, the likes of Evercare, likes of Redenting, Dorchester of this world, and even having international coverage as well, things that ordinarily, but because you belong to a pool, you're able to make use of those facilities and have access to the best care. Because one issue that a lot of people face has to do with financial incapacity. Something comes up, we get a lot of GoFundMe requests to take care of people because they are down with critical illnesses. But when you have a health insurance cover,
you don't have to do that.
You really would not need to go through that stress of doing GoFundMe and raising funds, because it's well taken care of. Maternity is
part of it.
Taken care of. It's part of it. You we both use glasses.
Yeah,
that is well taken care of. You know, you can still take care of yourself and look very chic. Dental is sorted out. Surgeries, oh, fantastic.
That's okay.
It's okay. So there are a whole lot of things that you can actually do with health insurance, and it would just like I said, that's the value that it gives you. The peace of mind, the fact that you spend less and you get exactly what you're supposed to get, and life goes on. It doesn't diminish your resources, your income. Everything is on auto. You need to cover your family members. The headache is not there that what's happening to my son in school, what's happening to my daughter out there, everyone is taken care of. So like I said, if you have a health insurance cover, oh, fantastic,
That's okay.
You'll be able to relate with what I've said.
Yeah, so I'm going to ask this next question, but I want us to just go for a short break. Let's have a break at first, and let's have some minutes so that, the next one, let me just take the next question so that you know. Now, this is the reason I realize there are some companies that do not even have HMOs for their staff, right? And there are some companies there are some persons who, even if the company does not, grant them HMO, they should be able to, insure themselves. So I'm sure for you to, understand what health insurance is, I'm sure there are some policies that guides that, especially with companies. So we want to be educated on that. I'm not saying employees should go and sue employer. That's not what I'm saying, but I'm just wanting us to get as much education as possible. Like, if it's not working there, I'm not saying go and sue. That's where you are collecting your salary. But you need to understand what it is between your employer and you being the employee. And also, if that is not working at all, she's also going to help us explain better how one can go about the health insurance, the various type of health insurance, especially for those who start from the low cadre, the ones who are collecting 100 or 150 or 200. Yeah, so in a very short time, we have very limited time, but we need to just take a short break, then we'll be right back. To stay with us. That's why you got me that way. But anyways, we're here to educate ourselves before we let her go. All right, so like the question I asked for companies, employees and employed, the fact of in fact, while we're talking about, like, do they sue people in Nigeria? Like, are you actually, you are the employee, where is the money for the lawyer? So we're definitely yes, but we still need the education to know exactly how it's supposed to work. Then also the other part of employees, how they can actually insure themselves, health insurance, let's focus on that. And of course, starting from the lower, I know there are people that earn 40K, there are people that earn 50.
Lower than that
too. But let's start with 100, because we don't have so much time. I think 100 will balance both the lower and the upper class too. So please go ahead.
All right, so we have laws in that the federal government have made things easier for us in the industry, making health insurance compulsory. So we have that on ground, and Lagos State is also doing a lot in terms of sensitizing and making sure that everyone has access to basic health insurance. Now, talking about coverages, right? So for us at HCI Healthcare, what we do is we curate packages that speaks to different cadres. We understand that, I mentioned earlier on that when you have a health insurance, your peace of mind is assured, right? And you're able to focus more on your core job and you're productive. Because if your staff are productive, your business booms and your profitability increases. So, and we understand that income varies. So you have a whole lot of individuals that have various salary levels, from some ranging 100, some lower than that. So we have packages for everyone. For organizations, we have benefits packages that we have wonderfully curated, having them in mind with the basics, all I've mentioned earlier on, outpatients, inpatients, everything is well taken care of, up to of course specific limits. And when we talk about limits now, it's not to restrict, right? But of course there are a whole lot of benefits that individuals and organizations start to enjoy. So having to enroll on our health scheme, we have our basic package covers everything that we've mentioned earlier on. So and in an organization coming in is well assured that, oh, my staff can go into the hospital, I want to put to bed maternity related cases, optical, dental surgeries, things like that, even taking care of the children. We're all all about that. And of course for pre-employment also, those are things that we also do for organizations as well. So it's all about that. And then we also understand that, after you leave gainful employment, you're retired. What happens after that? What happens? Just like for pensions, you're retired, you have your pension, and we all know that pension really does not take a lot of people home, you know, so we also have that in mind. And we've curated packages that speak to retirees as well, to take care of them after retirement. And for children, we have children plans, we have school packages, we have retail plans for individuals who may not be in any organization. And for entrepreneurs also, for those who are business men and women, there are packages that are curated that were very, very affordable and pocket friendly, that they can pick from. International packages as well. We also have partnerships with hospitals outside the country that, you know, we offer such services to our clients. So it's a whole lot of benefits that individuals start to enjoy on the HMO, within the HMO space that HCI Healthcare affords. And I can categorically say here, very, very affordable, because that's something that scares a whole lot of individuals and organizations, and they feel, with the bundle of liabilities that they have, HMO is the least that they want to bother themselves about. But we are saying that at HCI Healthcare, we are very, very affordable, and that our experiences, our client base can actually attest to that fact, that you want high packages, we are there for you. You want basic packages, your staff members are well taken care of while with us in HCI Healthcare.
I like this. This is a very good, insightful information, and I'm certain at some point, maybe later on in the year, we would invite you again so you could educate people a whole lot on health insurance.
It's very,
very important. That awareness has to be out there, and it's not just about the health insurance. We need to know more about insurance, because, you know, when we stick on health, it becomes only health. They tell you what's there for properties. Exactly. So it's just one out of so many things that you can insure, trust me, and it's very, very important. Well, and for those who their company, you know, chooses not to have this insurance for them, I'm not saying it's okay. I'm saying you can still do something for yourself from the little that you earn, because it's very important for you. Well, anyways, before we let you go, what is that one thing that you think you want to tell Nigerians right now that they still do not get, even when it comes to insurance right now?
Okay, so one thing I would tell Nigerians is this: your life is in your hands, right? And you can turn things around in your favor. The federal government have made things easier for us as Nigerians. They've made health insurance accessible. How well are you taking advantage? I know Nigerians are very, very good at taking advantage of things. Now, health insurance is something that we should all take advantage of. We have a whole lot of organizations out there, you understand? And if I would recommend one, I would recommend my organization, because we've been tested and trusted over time. Having over 400,000 lives, they can't go wrong. You understand? So that is something I would take advantage of what you have right now, and don't wait till something happens and you have to run helter-skelter before you sort out what you are supposed to sort out when there is peace of mind. So that's what I would
nice, thank you. Sort it out on time. It's not when the piece is about to go, you now start looking for house
up and down, and then of course by then
you will get more.
Spend much more, and then you just get what is thrown at you.
Whatever is thrown at you is what you will take, because at that point you are desperate. You're desperately in need of what you're searching for.
Exactly, and it could be late by then.
It might be too late. Yes, it's life. You know, some people tell you whatever that has to do with life and death is very important. So you have to always choose the life first. Oh, if I don't put you first, if you have a list of 100 to 10, put life 1 to 10.
Exactly.
You don't need, yes.
Once the life is there,
It's there. Every other thing will
is taken
definitely
care of.
work. Amazing, amazing. Thank you so much for educating
for
us
having
this
me.
beautiful afternoon. But before we let you go, we would like to have your social media handles and, of course, your WhatsApp line for those who want to reach out to you to know more, or they just want to ask some questions and ring you.
Okay, so we can be reached at agency at hcihealthcare.ng, right? So that's, and then social media handle, we're on Instagram, HCI Healthcare. You can reach us on Facebook, you can reach us on TikTok, and then our numbers on WhatsApp, we have 080-675-12063. I'll take that again, 080-675-12063 and 090-720-75196. So on those numbers,
they can
24/7 you can reach us. And one other thing, health insurance is 24/7.
Of
we
course,
don't
yes.
sleep.
It's just like a hospital.
Exactly.
You can't.
So 24/7, pick a call, and we're there at your service.
All right. Thank you so very much for the education, Miss, especially. That's one thing we always look out for. But before I let you go, I know I'm supposed to let you go at this point, but just very quickly in 1 minute, what was the most challenging period for you having to, switch? I'll start from the switching from here to here, then adding something else. There's just this transition, then working with this company, you had to move to another company, then now with here that you are. What is the major challenge that you went through, but somehow, somewhere, something never made you give up? You are here right now.
Okay, so I would say I won't call it a challenge, right? I would say it's a quest for more knowledge.
Okay.
Because I found myself, working in different organizations prior to now, and you want more.
Yep.
In terms of understanding what else can I get from this. Okay, I've gotten to this point. I want to understand more. There's much more that I can give, and then that's better the need to move from one place to the other, right? Just to ensure that, okay, there is, like I said, there's so many things you stand to gain and stand to learn in the HMO industry, and you just just can't stand still.
No,
you need to keep learning, relearning, and unlearning every single day. So those were the things that I considered, and that was the reason why
you kept
and up to where I am.
Where you are now. Well, we celebrate you. I celebrate you. Galaxy TV celebrates you because it's not easy. Trust me. That means you'll be talking a whole lot though. Because
it's my job.
I know, that's what I'm saying. Because people like, well, let me say, come, let me tell you, you will talk. But don't worry, you already said it's your job, and looking at it is no longer a job or a passion. And once it becomes a passion, you don't even see that stopping. Yeah, it's as if you're doing. People are paying you for what you do for fun. Exactly. That's what it is. Makes it more sweeter, more enjoyable. Exactly. Well, anyway, thank you so much for being on the show. Really, I appreciate you. Please keep preaching the gospel of health insurance, because we need to be insured. It is not only until we have the big properties and the big decisions for ourselves. Yes, I totally agree.
And then
scale up. Yes, thank you so very much.
Thank you very much for having me.
Yes, and that is Oluwafunbi, who has been here with us, gisting us and telling us so much about health insurance, a success story, a challenge, and of course, after telling the success story, we went a little bit into educating us about insurance and health insurance. But like I said, there is a promise that she'll be back again, maybe before the year runs out, so she will be able to give us in depth, not just words, but also things that we need to avoid and start doing when it comes to insurance. Well, till I come your way again tomorrow, same time, 12 noon to 1 p.m. I want you to have a lovely day, and you'll be seeing me on the buzz as usual by 1 p.m. You do enjoy yourself, and of course, I'll see you soon. My name is Rose Blossom. Bye for now.